Welcome, everyone. Thank you for joining us on the Disruptors at Work podcast. Today's episode focuses on the emerging epidemic of chronic cannabis use among teens and young adults. We're talking about an important topic today, especially for those states with changing legislation. So our guest today will walk us through what you need to know about marijuana use among teens, particularly for those who are heavy users. In the United States at this time, on this date of recording, which is Friday, April 16th, 2021, 36 states and 4 territories have approved measures to allow cannabis for medical use. And there are challenges in some of those states, and the approved measures are still controversial, including measures to protect citizens from criminal penalties for using marijuana for medical and/or recreational purposes. And to date, recreational marijuana legislation is rolling out on a state-by-state basis, with currently 16 states having legalized recreational use. And so as of today, 1/3 of all Americans live in states in which marijuana use is legal in some form. So I'd like to introduce our guest today, Dr. Jodie NewDelman, who is a psychologist in Marin County, California, where she has a small private practice and also consults with health technology companies. And Jodie, we are lucky enough at Cummings Graduate Institute to have Jodie serving on our advisory board, which has been incredibly helpful to help us inform our curriculum in the Doctor of Behavioral Health program, as well as some of the continuing education areas that we're strategically enhancing and expanding in 2021. So Jodie, thank you so much for joining us today. I'm really excited. I think we, as we said before we started recording, we could probably talk for hours and hours on this topic. It's really important right now. And truthfully, in my practice with maternal mental health, moms have a lot of questions about use of cannabis. And oftentimes, the terms, well, it's natural, it's from the earth, are used to talk about this, but we also know that the cannabis that's available in the dispensaries is really, really enhanced. It is much stronger, and it has some really big psychiatric potential that parents need to know about. And certainly in my practice, that pregnant women need to know about.
Sure.
So again, thanks for coming with us today. I really appreciate you being here.
Thank you. I'm glad to be here as well.
Yeah. So let's just start by, talking a little bit about what you're seeing in your practice, maybe describe your practice a little bit for the listeners, and talk about what you've been seeing recently since California has passed some of the legalization legislation.
Sure. So I can say that from a professional standpoint, in higher levels of care, where we've seen families bring their kids into treatment when they need more than therapy once a week or more than counseling services at school, where there's more concern about substance use and abuse, as tied to mental health issues, depression, anxiety, other behavioral issues, attentional issues. What we're seeing is really a marked increase in kids that come through mental health practices that are exposed to substances, many substances. And I would actually say that the numbers that we're seeing from the CDC are actually low in some areas, particularly those states that have legalized cannabis. The numbers, I think, was just around 30 something, between 30 and 40% of kids have tried it. And I would say in some areas where there's legalization, it's much closer to, potentially 80 or 90% of kids that have tried.
Yeah.
So I think that we can't really use the same sort of mentality when approaching this. It's sort of normalized for this age group. And I've heard kids say to me that it's abnormal if you haven't tried it. And they have to really be strong to actually say no for the first time. There's a lot of peer pressure out there, as there always has been. And I feel like a lot of times my practice revolves around helping parents cope with their approach. to managing the issue with their kids. So yeah,
parents need tons of support, but I don't think, if parents are not entering counseling, I think they are afraid to talk openly with other parents about their worries for their own kiddo. And I also think, and this seems to be something I'm encountering as well, is there seems to be, even if recreational use is legalized, people are still not, they're so used to marijuana use being illegal that when they come in to a physician and a physician is asking, what kind of medications are you taking? They may not share that they are using medically cannabis or recreational cannabis.
Right. And somehow there's this idea that, parents can openly talk with their kids about drinking, right? Yeah. And in some cases condone drinking and condemn marijuana use,
right,
as separate, right? And I think that there's a reason why there's a legal age limit for liability and legal reasons, but also because they're much closer to full brain development when you get into the 20, 21, 22 range. That being said, I think that all of us, whether you're an adult or a child or a teenager, need to be able to openly have conversations about a relationship to substances, or frankly, anything that's consumable, including media and screen time and anything that's consumable, food. And to some extent, these are also prime years for adolescents to be exploring themselves, their identity and their sexuality. So in terms of having a healthy relationship with not only substances, but your own sexuality and engagement with other teens. And so, I'm biased because I'm a psychologist, but my feeling about the topic is the more parents can get engaged and have open conversations with their kids, the more protective that becomes as a factor in preventing long-term chronic problems with anything. Having a securely attached teenager that feels that they can take the risk to approach a parent and say, well, this is what's really happening, without fear that their parent is going to condemn or punish them, which really is a conversation stopper.
Mm-hmm. Mm-hmm. Yeah, I agree completely. And in my practice, I've had a couple of moms with older kiddos, adolescents, who wanted to use marijuana medicinally because they said it helped them sleep, but they're also not 18 years of age, certainly not 21 years of age. And so there are some concerns. And I know parents are often feeling like they don't have the data to make a good argument or to set limits with their kiddos. And so oftentimes it's either the black and white, don't use it at all response that parents give, which may be appropriate. And I would say it is appropriate, just, based on what we know about neurological development, certainly in kiddos. And at the same time, we know that there is good evidence that the use of cannabis can be helpful for things like insomnia, and also for, kiddos with autism and sleep disorders. So what experience, or what have you seen, what observations have you seen in talking with parents of kiddos with those kinds of, sleep disorders or autism? Tell us a little bit about that. What do you recommend?
Well, okay. So there's a fine line between, when we talk about addiction or dependence, there's a fine line between chemical and biological addiction and behavioral habit forming problem lifestyle. So if you ask people that are habitually dependent on marijuana, they'll tell you the hardest part about it is the behavior, that whether it's the social element where everyone in a room is using, so it's like it's not hard not to participate in that behavior, versus the effect of the actual drug. So I think it's important to tease out whether or not whether it's an adult or a teenager, is dependent on the substance or dependent on the habitual behavior. Sorry, my ringer was off. So to answer the question about about treatment, I think it's all emerging, right? The research is still all emerging, and whether you can apply that research to adults or teenagers, it's really an emerging science. And I think everybody has individual differences, right? So for example, if somebody says, oh, I really want to try cannabis for sleep, or CBD for sleep, or THC for sleep, or to regulate their behavior in some way, my go-to response would be, well, what have you tried so far, right? What have you tried? What is the standard practice? And have you really invested the time in sleep hygiene? Have you, committed to turning off your screens an hour before bed? Have you stopped eating a couple of hours before bed? Do you engage in relaxing activities before bed? And do you have a set bedtime? Is there an environment where sleep is conducive at a particular hour? Is your family supportive of that? Or is there, activity happening in the house before bed? So those environmental factors and family functional dynamic factors are has a stronger impact on whether or not a kid is able to fall asleep than whether or not they're taking the CBD or the THC. So, and we have to be able to look at families and talk to families about what their family patterns are. Is it your family pattern to take a sleeping pill to go to bed?
Right.
Is it your parents' family patterns to, have a TV in their room and watch TV until midnight before they go to bed? What sort of modeling has been learned in the family in terms of addressing problems? And, I'm not the kind of practitioner that can work with a kid and not recognize the larger family dynamic, most often the multi-generational patterns that exist and that have been conveyed through the generations. So with most kids, I like to at least get parents to activate around whatever the problem behavior is and recognize their role in perpetuating that. Right. And not put it all on the kid. It's really, I always say that adolescence doesn't happen to kids, it happens to families.
Right. Well, and I think, just the word itself, adolescence, the meaning is becoming an adult. So it's a full, it's a family experience, but I think so many parents struggle due to the fact that they perhaps didn't have great modeling themselves as teens. Perhaps they're trying to reverse, some dysfunctional family patterns or some trauma or abuse, that they experienced as a kiddo. And they, at the same time, don't have a lot of great modeling for reversing those trends. And so they're kind of wading into new waters.
Yeah.
Testing how that's going. And I know some of the folks who are saying, well, what do I tell my teenager, are also those who say, I started getting high when I was in middle school. So, I don't want to be a hypocrite, but how do I tell my kiddo not to do what I did? Right.
And I would argue that it's not about telling your kiddo anything. It's about asking and being available and interested in what their experiences are, curious about how your teenager experiences the world, how they experience their friendships, what the layers are in their emotional landscape. For example, how are they doing in school? Are they able to feel successful? Do they feel connected and engaged with their peers? How do they manage distress when they get a bad grade or feel rejected or don't make a team, or someone looks at them funny, or they start comparing their body shape to someone else? All of these factors are the ingredients to how a teenager modulates their self-concept and their mood and their emotional awareness. And often, like adults, when we experience things that feel uncomfortable, what's the, often the tendency is to avoid the feeling, to either push it away or distract yourself, turn on the TV or eat a chocolate cake, or say, oh, I don't want to think about this, have sex, right? Do whatever they can to not feel the feeling of distress and upset. And as parents, what we can do is heighten our own ability and authenticity in experiencing our own emotional regulation, right, and model that for our kids. And feel connected to them emotionally. So there's a landscape to be able to explore whatever it is that they're feeling, whether it's good or bad.
Mm-hmm.
Most
That's interesting.
Yeah.
I'm sorry to interrupt you,
yeah.
But what I hear you saying is there are so often times where we go to, take a pill, turn on the TV, distract, dissociate from the uncomfortable experience that you're having.
Right.
And so for us as adults, we are modeling that behavior for our teens who live in the house.
Yeah.
And holding them to an unfair standard when we say, don't do what I'm doing, and, certainly from a very young age, I have one 15-year-old son. He's an only child. And
mm-hmm.
I can't tell you how often, we'll say, go to bed. And he'll say, well, you guys are just going to stay up late and watch TV.
Mm-hmm.
So it is that discrepancy between what we're telling him to do is good for his health and wellness, getting enough sleep, making sure that he has good rest and good hygiene. And here we are watching TV until late in the night. So.
That's right. Teenagers love that. They love to point out that their parents are hypocritical.
Yeah, fair enough. And I think what I also heard you saying, which is really important to me as a parent of a teenager, is it's the connection, it's the deeper level of compassion, and it's the idea and the focus of the relationship, the building the trust, building the bond further,
mm-hmm.
Instead of responding to the situation at hand.
Mm-hmm.
Take an opportunity to say, this is something that my teen is asking for more connection.
Right.
And the way I respond, can really make or break this moment.
Yeah, I think it's really the hardest job there is on the planet. I mean, I want to acknowledge, parent raising a kid. No, there's no manual for that. There's no class you can take, to pass and get a license in order to have a kid and know that there's a right way or a wrong way. And people tend to go out and seek resources that align with their own values anyway. Whether you're a cry it out kid or an attachment, co-sleeping parent, one way or the other, you're going to find the resources that align with what you want to do anyway. But ultimately, we find that kids that are securely attached, right, that feel comfortable confronting their parents, knowing that there's going to be an openness to that response rather than, just do it because I said so, or because there's a conditionalism to, if you do that, then I will pull funding and you can't go to your favorite school, or, whatever it is, I'm not going to buy you a car, whatever the conditionalism is. I think that has an impact on a kid's willingness to be open and forthright with their parents. I think that, I don't know if we're getting enough into the nitty gritty about the cannabis piece per se, because I think that the jury is still out in a lot of ways regarding research. Like you said, a lot of these parents, especially in the states where there's legalized marijuana, you can go to a dispensary and these kids are getting access, more and more access to, high quality, regulated product.
Mm-hmm. Well, and especially with the new edibles,
mm-hmm.
When some of the dispensaries started opening in states like Colorado, early legislation passed on recreational use. It wasn't just, that the worry that kids, would have greater access. It was also, that they may mistake gummy bears, for a parent's secret stash of candy and consume those in error. And then in addition to that, of course, teens having access to lab quality THC,
right,
with their developing brains. So, just being able to, again, go back to the idea of how much do you know as a parent about, what is on the market in dispensaries and available, not to you, but to the families of the kids that, your kid is socializing with. And
right.
How are you talking about that with them?
Right. Or are you talking about with them? Right. There's this kind of underlying belief in some parents, well, if I don't talk about it, I'm not modeling it, I'm going to hide it from my kids if it's in the house. And I do think that we have to be mindful of what we're modeling behaviorally and what we're buying and bringing in front. I mean, how many families do you know that have a cocktail party or have a party with friends and are serving wine at dinner, and these kids don't have an understanding about how one is okay and the other is not okay. And I would say that, alcohol, arguably is a much more, difficult thing to manage over the course of a lifetime in terms of chronic use and damage to body systems. That's not in any way me condoning, kids using more weed than alcohol. But I do think that it's worth elevating your family conversation with facts. So if a kid thinks they know everything, which most do, right? Like they know everything, they're invincible, nothing's going to happen to them, everything's going to be okay. What do you know? You're just a parent, So we have to sort of absorb that response with a knowing internal wink and say, oh yeah, I remember being that invincible teenager as well. Or that anxious teenager, whichever one, resonates with you, and elevate that conversation to fact-based information. So if your kid is able to express to you that they're using, what form are they using in? Are they smoking? Are they eating edibles? Are they, what's the terminology that they're using? What lingo is he using? Are they using? Are they vaping? We have to be able to say that we don't know everything there is to know, because that's the truth. We don't know everything there is to know as parents and as professionals. But what we do know is how to recognize when our kid looks like they're going off the deep end, right? When your child is making more errors in judgment than your average teenager, when a high-performing student stops high performing, when they're becoming more and more isolated, when they're having difficulty coordinating themselves, when you see other signs of difficulty, I think those are the things that are really more important to focus on. Rather than say, okay, let's blame the drug or let's blame the behavior. In my practice and in the families that I've seen really successfully come through the roughest times, it's because we've been able to get beneath the behavior. What drives the behavior? What is the reason why your kid is attracted to doing this in the first place? What are your child's triggers? So that's the first layer I think is important to explore if you can get that conversation open. And, sometimes getting the conversation open is the hardest part, right? And if that requires facilitation, of course, I believe in, seeking intervention, finding a professional that can work with you or your family, work with your kid to sort of explore why there's an impediment to that communication, right? What is it that they don't trust you to say? Or what is it that they can't say to you because they don't totally trust that you'll have a response that validates where they're at, right? So we talk a lot about emotion coaching in my practice, as opposed to, oh, you're okay, everything's fine. Or, I just want to make this point because I think it's one of my favorite tools when I'm working with families is, well, there's two of them, but one of them is the power of learning how to reflect what you're seeing in your child, right? Instead of reacting and telling and commanding, do this, do that, or here's the rule, here's my boundary, here's my expectation, to be able to really open up the conversation to what you're seeing in them. Like, oh, I'm noticing that you're spending a lot of time alone. What's going on? Or weighing what's developmentally appropriate and being alone in your room and talking on the phone for hours at a time is developmentally appropriate. It looks like isolation, but sometimes it's not. Sometimes those kids, or the ones that are on video games for hours and hours at a time, and you think, oh my God, they're in a deep, dark hole. Half the time they're on the video game with another person, socializing in a pandemic, the only way that they can socialize. They are biologically driven to do the social thing. They're also biologically driven to become autonomous, to learn how to practice their own autonomy. So as parents, we have to be able to say, oh, okay, I need to give them safe and appropriate ways to practice that autonomy.
Yeah.
So opening up the rules, even if they feel risky to you, to say, all right, well, let's see how you can handle this level of responsibility and autonomy. And saying, being able to explore, well, how did that work out for you? Even if there was a mistake that happened, being able to say, okay, well, that was a mistake. How can I help you be successful the next time we try and let you have this autonomy? So a lot of what we talk about with cannabis and alcohol and other drugs that they may be experimenting with is less about the drug and the rule, and more about the information and access and communication and the availability of the important relationships that exist in family members. Because one way or the other, either a kid's going to go off the rails or they're not going to go off the rails. The ones that go off the rails and we're able to draw back are the ones that can rely on those strong relationships to support them. Yeah. And the other thing, besides like the emotion coaching piece, is the power of parent apology. It's amazing how difficult it is for some parents to say, oh my God, I totally screwed up.
And I think that again goes back to the lack of a good model, in a parent's life. Growing up, many of us were raised by parents who never apologized because they didn't think that parents should apologize, that parents should be, authority at all times. But being able to be vulnerable with your kiddo as they're growing up and, demonstrating that, you too, as a parent, acknowledge that you make mistakes and that, sometimes you mess up and that sometimes you're not right and sometimes you don't know, is part of giving them that autonomy, in themselves, giving them permission to be a whole human being.
Absolutely, Cara. I mean, this is the time in their lives where we have to be able to pass the torch to them in some really meaningful ways. So it used to be when they were 4 or 5 or 6, they would, look to you for everything, right? They wanted your advice. They wanted your attention. They wanted all the things that, if we told them something, they would believe it, often. And now in this period, they're really trying to differentiate and individuate and separate. And all of that is really normal. And it's also very painful for parents to see that moving away from that sort of role that they've had in the past. So the more we can get parents to accept that their kids need to practice that autonomy and that independence and that separation, and that's normal and healthy, the better the separation and individuation process goes and the more securely attached they become. So it's kind of counterintuitive, what we see in practice. And I think just to kind of circle back to the whole what's underneath the use, factor, if we can, as parents, cultivate opportunities for our kids to engage in serotonin and dopamine, oxytocin, and endorphin experiences, like enhancing experiences, neurochemical experiences that do the same exact thing, as the psychopharmacological agents that are often used in psychoactive medications and psychoactive drugs. What are those things? And they could be super practical. And I just have a list of them for you if that would be helpful.
Please.
So dopamine is sort of like a reward chemical, right? So even though there's plenty of drugs out there that open up these dopamine channels, completing a task, feeling accomplished, doing sort of, self-care activities, having a bath, right? Eating regular healthy food, celebrating little wins, feeling like, you can give a high five to yourself or to your friend, those are all sort of rewarding activities, and they actually do have a biochemical, neurochemical impact on mood and behavior. Right. Oxytocin is what we call the love hormone, right? So, teenagers love to be loved. They want to be connected to other teenagers, right? And it's so much of our history is like having them as our little kids and wanting to hug them and have them and hold them and snuggle them, and a lot of times this is the time where they're not wanting that so much. And it's right. So hard as parents to say, oh, but I just want to give you that love. They can get that, in other ways, with connecting with their friends, with playing with, a dog or a cat or a baby, holding hands, hugging someone, other than, a parent, or maybe even hugging a parent, giving compliments, any sort of connectedness that you can encourage. And I think that that's really important. It's really difficult for parents to kind of accept the transition from being family centric to being socially centric. Right. But that is such an oxytocin focused activity for teenagers that feeds them and nourishes them in a way that minimizes their risk for overusing drugs.
Well, that's interesting too. Just sorry but yeah. To kind of unpack that from the parent perspective, I know my husband and I, we have one son, and he is our only, he's our sunshine. We revolve around him. Mm-hmm. And that is starting to shift with him being 15 and in high school. And, the activities that you mentioned that normally would have brought dopamine or, that dose of oxytocin that, that bonding and loving kind of, a release are not as available to us anymore. When he was a little kid, we had chore charts, and he would get a sticker and a reward at the end of the week if he did his chores every day. And, the way that we connected, hugging and, holding hands and taking walks together and things like that, it's completely out the door. Right.
Right.
And yet at the same time, and I recall from doing, some parent lessons when I was a middle school counselor, on, the ratio of positive reinforcement or, rewarding kinds of language, like great job, or yes, you're doing a good job, or, those kind of positive verbal reinforcements for kiddos, when they enter middle school, goes down by 2/3. And so for kids, it's a huge relationship change when they become older, because more of the feedback that they get becomes more negative. More of, I'm only going to remind you when you're not doing the thing that I want you to do, rather than, and part of that is because we just don't see them as much. We're not as involved in their day-to-day academics or, worlds. And so what are some of the things that parents can do to boost those dopamine and oxytocin releasing
Yeah. Well, I think it's not a matter of those things going out the window. I think it's just a matter of upgrading them or reframing them in a new way. So think about, they're probably more aligned with the way that adults receive feedback. So I think it's important to know what your quote unquote love language is, right? Yeah. So if you know that your kid responds to physical touch, but they might, as a teenager, not want it in the same way or as much as, or as unsolicited, right? So if a kid has their door closed, right, sort of respecting the fact that the door is closed, maybe when they were littler, you might have walked right in, right? Now it's time to sort of respect the fact that they are in this age and knock on the door. And if they say, don't come in, or I'm not ready, or what do you want, just to be able to say, all right, I'll come back when you're ready. Right. So be able to sort of acknowledge what they're asking for by interpreting that sort of nastiness or abrasiveness that might come, or that blocking doesn't necessarily mean that they don't want to be loved or physically touched. It's just that they're going to want it in a new way. Right. So recognizing when they're receptive and when they might need a pat on the back or a hug or whatever, or I think that's important. I think it's other things that I think if a kid knows that they want that sort of positive feedback, if they're, having that conversation, like, does it help you when I notice that you're doing great things? Like, do you want me to recognize that? Or are they more interested in having you just be there, right? Be available for them.
And again, I'm hearing that opportunity for deeper connection with your kid as they are developing. So instead of just making an assumption, trying something out, getting frustrated and throwing your hands up in the air, it's an opportunity to ask them for their preference and then try to tailor your your reinforcement to their preferences.
Right. And I wanted to just mention a couple of other, neurochemicals, so we talked about dopamine and oxytocin, and there's serotonin, which is like the buzzword everywhere. And it's really just the mood stabilizer. So a lot of times teaching a kid meditating might look differently than an adult meditating. Right. So for an adult sitting there and trying to practice breathing or mindfulness, for a kid, it might be having a run or laying in the sun or swimming or cycling, like biking or something where it's more of like a repetitive mantra, even if it's like a physical mantra where they're just kind of engaging in that sort of activity. And just knowing that is valuable time spent, right? And endorphins are what we classify as a painkiller, right? So laughing, so what? It's another screen time activity, but if y'all like to watch the same show and laugh together, great, awesome. Maybe it's more screen time, but if everyone's rolling on the floor because of a TikTok, fine. That you have to be able to see the trade-off in all of these activities. So also, like, having dark chocolate, exercising, essential oils, the more you can add these things into your environment, the more you're enhancing all of those neurochemicals, and you're kind of being open to it as a family and really cultivating a stable base that minimizes the risk for them to seek those chemical bumps outside in ways that are dangerous. Right.
I love that. And thank you so much for going through that, Jodie, because I truly don't know many parents who've not been through a psychology training program or a medical training program who understand the role of neurochemicals, or how to produce those through natural, activities in family life. So I really appreciate that. I know for parents and even for other mental health providers to be able to, recognize what those activities, those neurochemical boosting activities are, and recommending those is absolutely part of doing a better job, meeting the whole person that you're working with and providing them with some opportunities to deepen connection and to, really work on boosting those neurochemicals in natural family dynamic ways.
Sure. And I think that it's a relief, right? So in the same way that chronic cannabis users might feel a relief when they have that mind shift, right? When they're suddenly engaged with their peers, or they can see the world in a different way. It's the reframing piece, and it's actually just a relief from the stresses that they're experiencing. So I would call that self-medicating, right? So, and to some degree, I think that we as adults need to recognize that, for ages, people have been coming home from the office and kicking off their shoes and say, oh, I need a drink, right? And if that's what your kids are seeing on TV, or that's what they're seeing in their family, they're saying, oh, okay, well, if I just have this cocktail, or if I just smoke this joint, I'm going to be able to just wash the day off of me and relax, right? The problem is when that habit becomes a problem and a behavioral issue that really mutates what the underlying stresses are. So the behavior becomes a chronic avoidance of the feelings that are difficult to manage, and to tolerate that distress is a life skill. So we need to be able to, as parents, recognize the value of teaching how to tolerate distress without using substances, right? So you can go through all of those sort of hormone inducing, neurochemical inducing behaviors that are part of wellness, right? And coach your kids how to have a wellness lifestyle, because it's neurochemically enhancing to them. But also it's the behavioral function of teaching them how to tolerate distress when things go wrong, because guess what? There will always be something that goes wrong. There will be divorces, there will be pandemics, there will be broken legs, there will be loss, there will be breakups, there will be missed packages and car accidents. There will be difficulties that come for the rest of their lives. So as a key feature of parenting, I would really say that teaching your kids how to tolerate distress is a critical factor, because otherwise what happens is that if they don't have those skills, they start to depend on the behaviors to avoid feeling those distressing feelings. And then the behavior becomes the problem instead of the actual problem being the problem.
Yeah, I think too, when there is not that deep and trusting relationship with a parent at home, kids naturally turn, like you said, to social activities. And we know that one of the worst places kids can get facts is from another adolescent who probably doesn't know, more than all the benefits and none of the, consequences of using marijuana, either, one time or chronically. And so being able to, have that fact-based conversation, and really tuning in to the opportunities to connect in a deeper way, and providing your kids, I'm just thinking of, we used to be a lot more active prior to the pandemic. We used to, come home and then want to spend time together. So we would take the dogs for a walk. Well, during the pandemic, a lot of those behaviors changed. And I'll bet that this is, something that many of the listeners are reflecting on, is how life has changed over the past year to, not as interactive, not as out in the community, more homebound. And certainly we all know that the drive towards substance abuse, alcohol use has gone up like crazy. And then with recreational use of marijuana being an option now, I'm certain that both, adults and teens are turning to that more often than not to escape. So, but the good news is that with vaccinations on the horizon and, the growing number of that, we can get our lives back. It's just going to be a matter of focusing on, okay, I don't like what we've become, and really taking strategic steps to start replacing some of the escapism and easy button, dopamine hits, serotonin hits from booze or TV or food or inactivity, with some of those healthier behaviors. But I imagine it, behavior change is hard, and we know that it takes time. We didn't get, to where we are now overnight, and we're not going to get back to a healthier place overnight either.
Right. Yeah. Well, so I would say that, some of the things that you mentioned is, like how do you know when it's a problem, or are you a parent that really fundamentally believes that any and all use is a problem, right? Yes. And even if you believe that, any and all use is a problem, having that mentality when you talk to your kid who's using is going to be like an automatic barrier, right? They're going to feel judgment. They're going to feel shame. They're going to feel accused. They're going to feel, that you will never understand. Right. And you may or you may not understand why they're doing the things that they're doing. But I would argue that the approach and that interaction between parents and kids is sort of the critical barrier right? The critical barrier is the way that you're speaking to each other constructive, right? Is the approach constructive? Are you getting, and say, for example, you've noticed your teenager has difficulty thinking or problem solving. Maybe you've noticed that they were high performing and now they've got problems with memory and they're not learning. If they've got some sort of impaired coordination or they're having difficulty, paying attention. Well, that could be, all of those things could be an artifact of chronic cannabis use, but all of those things may also be reflecting an underlying mood disorder, or there's no one on the planet that's not affected by the pandemic right now. And, we are not separated from our bodies. Our minds and our bodies are integrally connected. So there's no easy way to say, okay, that's a chronic cannabis user and that's the problem, versus that's a kid who's really depressed and their behaviors are becoming the problem. And, we need to address the behaviors, because I just don't really believe you can address the behavior without addressing the underlying issue.
Absolutely.
Because even if you can get a kid to be abstinent for a week or a month or 6 months, they still are operating in the same social system and the same family system that created that cultivated those attitudes and those moods to begin with. And some of that could even be multi-generational, right? Like the way that your family has coped throughout the ages, or, sort of multi-generational artifacts of old trauma. You have families that are.
I've worked with families, who, young families where I'm working with mom because, moms are my specialty area right now. And, she's concerned about her husband's alcohol use, and her husband is not concerned at all about his alcohol use, because in comparison to his first family of origin, father, brothers, uncles, cousins, he's actually using, on the lower end compared to his family of origin. Mm-hmm. And they're all employed and they seem to be okay. And so, the same is absolutely true for other family, kinds of dynamics. If it's not viewed as a problem, but it is a problem within the partnership or within the family system, something has to be done. Right. And, again, if you're focusing just on the alcohol consumption of behavior, or in this case, cannabis consumption, then you're missing the root cause. Right. That is causing the behavior to begin with. And if that's not addressed, you're going to come back again and again to that self-medication strategy.
Absolutely.
She was still there.
Yeah, absolutely. And then I would say another sort of guiding principle for the way that I work with families and with any client of mine is targeting what the core values are in that individual. So some people don't even know what they are. Some people don't even show up knowing what their core values are. And it takes a few sessions to really explore, what is it that you really believe in for yourself? What are your guiding principles in life? What do you want for yourself? Where are you going with your life? And what is important to you? Mm-hmm. And having a look at that for teenagers is equally important, even more important, because they're just launching themselves into adulthood. So a lot of times, a lot of the stress and confusion and frustration and mood relates to not knowing what they want, like not having a solidified idea of what their future is going to be, and really not having a fully formed identity and clarity of the kind of adult they're going to wind up being. So that sort of level of disorientation is also difficult to tolerate. So parents that have that sort of nuanced understanding of how it feels to be stuck in that kind of quagmire of indecision are going to be more constructive with their teenagers as they develop that identity over time.
Sure.
So the idea is how much parents fear. Like, what is their fear? When they respond to their kid with yelling or a command or something that really stops the conversation or ends up in the same sort of patternistic power struggle, yes, right, that we see all the time with teenagers, what is the power struggle about? And normally it, what I more often than not hear is that parents say, well, I just want to make sure they're successful. I just want to make sure they don't ruin their potential, or I just fear that they're going to end up like my, like their uncle or whatever.
Sure.
They're just worried about stuff. So, and with all good reason, right? And sometimes the kids are the same way. They might be operating based on fear, like, well, if I don't do that, they so and so might not like me, or they'll think that I dress weird, or they'll think whatever they think. It's all fear-based decisions that they're making, and then you get sort of entangled in this power struggle that's based on fear, fighting fear. And really what I try to help people do is focus on, well, if you weren't so afraid of those things, right? If you could take fear out of the equation and replace that fear with daily decision-making based on your core true values. And even if it feels scary or risky, or there's fear involved in activating around your choices, around your values-driven choices, then you're living a meaningful life, right? You're taking responsible risks because you're going in the direction of what you want.
Right.
Right.
Such an empowering way of looking, at reframing a situation for, a family, because, family members may not always 100% agree on core values. There may be some differentiation, but the big values, people can usually agree on those. And if they can tune into, moving away from fear-based decision-making, and if they can try to tune in a little bit deeper to, let me review my values, it's an easy decision.
Yeah. Right. And then there's the families that feel like, oh my God, I poured so much energy into my, the raising of this child, and then it's all for naught. Like, it's all going out the window. They're going to throw it all away because they're going to, get into a car wreck because they get behind the wheel after using, right? That's a legitimate fear. That's really, really potent. Parents are like scared to death that something horrible is going to happen to their kid. And I think that guides the harshness of the communication, and the punishment, conditional kind of language around what they can and cannot do, as they're trying to release, put some slack in the tether and allow their kid to explore their autonomy. There's always going to be risk. Right. Always going to be risk. And as parents, we need to be able to tolerate our fear long enough to pivot, to apply our values to the relationship, which I would encourage is the connection piece, right? Because that's the most protective piece. That's the one that's going to say, well, my family values and my connection to my family is so potent that I'm going to make this choice out there when I'm with my friends versus this choice when I'm out there with my friends. And that's pretty sophisticated. So I think sometimes families have to go back to the drawing board and say, okay, there was this trauma in our history, there was this divorce that happened, or there was this loss that was experienced, or there was this rupture in the relationship early on that we've never really repaired, right? So of course my kid is, as they're coming into their own independence, is seeking some sort of relief, some sort of other way to do it. And so a lot of times the kids, drug use is related to rebellion. Like I just need to be away from them. I just need to do things differently than them. And I think that the more we can kind of open that up, the more we can bring things to the surface. It's not easy. None of this is easy.
No, but you bring up such an interesting point on an interesting week, because Brene Brown, who I love, she, has released a podcast this week on in her Dare to Lead podcast on armored leadership versus basically, heart-driven leadership. And as you're talking about, the idea of a parent saying, this is a hard thing to acknowledge, but it happened. It definitely is potentially the big difference between the parent who says, I'm just so worried, all this investment I've made in my kiddo for them to just throw it out the window. That's armored leadership. So we're going to shut it all down. And when that happens, you shut down creativity,
Mm.
and, the ability to have lots of voices at the table to solve this problem, which is we have a kiddo who's disconnected. How do we reinvigorate this connection? And again, connecting to the heart, connecting to the value system, that makes it, first of all, it engages the kiddo in the problem solving process. And, it also helps parents really reinforce the family values that are important to them, despite the fact that difficult things are or have happened.
And especially because their teenage brains are at this developmental stage of abstraction, like they're well beyond concrete thinking, and they're really coming into their own sort of like emerging adult brain. It offers an opportunity to have much more sophisticated conversations about things that couldn't happen before, right? You can have these higher level, what I call process oriented conversations that are not just, they're not content driven. They're about like, okay, well, what is it that I just said that upset you so much? To help me understand the thing that I did that caused your reaction, right? So elevating the conversation to process oriented discussions once in a while, not all the time, because that can be really off-putting, right? Sure. But being able to have that space open to have them negotiate, like, okay, well, if you're really serious about that, mom or dad, I really can't stand it when you barge into my room, or I really can't stand it when, you tell me one thing and then you do another, or whatever it is, right. Or you tell me, oh, I'll be right there, and then you're not there for a half an hour. Right. So when they have the courage to be able to talk to you as a parent, in that sort of transparent, negotiative way, then a parent, if they're receptive and say, oh, okay, I see you as a person. You're not just my kid that right. I can control. I see you as a person evolving and being separate from me, and I respect that. And therefore, here's what I can do to adjust my behavior because I love you. Right. And then that earns a lot of respect from your kid. And then it kind of paves the way to having an adult relationship with your child, sure. Down the road.
Yeah. And, I think we could probably talk all day about this, because there are so many things to unpack when it comes to, a topic like chronic cannabis use in teens is, days and days of
right.
conversations. But I really appreciate the perspective of, here are some things you can do. Like I mentioned, I spent a lot of time as a prevention, person in the world of prevention. My early career was focused with birth to 5 population. So a lot of work with very, new families, young parents, very little kids, talking about, how to resolve some of those dysfunctional family dynamics and how to create some of those synergistic, okay, here are our values, and so here's how we're going to do problem solving in a creative, way across the family. It's the brushing and flossing of family life together, so that you don't get to a point where you suddenly have a kiddo who's using drugs, or alcohol in a really harmful, maladaptive way. But at the same time, I really also truly appreciate the idea that I think for a lot of parents, they have no clue what to do if they suddenly learn that their kiddo has been using. And they just learned this information, or, a kiddo who is arrested, at 17 years old for a DUI involving alcohol and marijuana. And this is a kid who normally is a straight A kid. Right. Or any of those kinds of things, because the opportunity to connect, to get to, the true heart of the matter, and, to look at the root cause is something that in our society, historically, we haven't done very well. We've been more litigious, we've been more punitive, we've been more black and white, with the way that we look at substance use. It's been considered a moral, a weakness or a failure, rather than, self-medicating and right. choice, to help engage those neurochemicals that we have not had access to. So I really appreciated, the list of ways that families can, really provide opportunities for themselves and for kids. Yeah. Those natural boosting experiences, and also, the way to respond as a parent to, learn the knowledge or learning that your kiddo has been engaging in chronic use.
Yeah.
So.
And I think that you raise a good point about, the tide changing in terms of punishment as a concept versus restoration, right? Like, you hear a lot about restorative justice these days, and we've known in the mental health and behavioral health world for a long time that there are seriously problematic, there's serious problems with punishment, right? It's great for like dog training, right? Or very little kids, right? But really, honestly, it's
more complex than that.
It's way more complex than that. And to really have long lasting change, you need to be able to reinforce positive behavior. So the more you're reinforcing, from a very behavioral perspective, reinforcing positive behaviors and learning to self-reinforce positive behaviors, like, say you want to build a habit that's a healthy habit, do 10 push-ups every time you flush the toilet, connected to something that you do all the time, and then look at yourself. And the key is not that. The key is looking at yourself in the mirror and say, you did that.
Yeah.
Good for you. Pat yourself on the back, because you're learning how to give yourself that reinforcement and say, I want to do more of that because that was aligned with my values to, build muscle, right? Or whatever the behavior is. So I think that there's the concept of punishment and reward is really evolving in society and culture. Even looking at the way that prisons are handling incarceration and repair. And I think that easily parallels to how we parent and how we approach missteps in our kids. Do we want them to feel punished and isolated in that punishment and stew in how we feel that they've done something wrong, or do we want them to learn something from the experience and grow from it, and do we want them to feel as though we're there with them as they wade through that swampiness, as they wade through whatever difficulty they're experiencing, whether it's body image issues, relationship issues, academic issues, whatever teenagers are experiencing, that we're there with them, right? And that we expect them to make some mistakes because that's part of learning, and that it's okay for them to feel whatever they're feeling, and that it won't be forever. And right. That there's sunshine at the other end of that swamp, and we can swim through that together.
Yeah. Well, and that leads me back to, the original thought of being a vulnerable whole human, showing up as your whole self when you are a parent, and I guess rejecting the idea that parents need to, know all and, be the authority 100% of the time, for, the more integrated identity of a parent as a whole human who mm-hmm. isn't perfect because no one is, makes mistakes because everyone does, mm-hmm. and has compassion for, the process that they see in their child because they went through it themselves and they remember what it was like. Yeah. And what it is like as a human now as parents. I mean, we all have mistakes on a day-to-day basis. So being able to reflect that and share that part of your life with a kiddo.
Yeah.
It's very preventative, but I think it's also important in the approach when something does go wrong, like when you find out your kid's using.
Yeah. Yeah. And I think it aligned, and I think this is just what I don't want to forget to say this before we wrap, is that helping your kid crawl out of that problematic use situation that they might be in, if you can get them to believe that you are on their side and there's transparency in that sort of recovery process, is that we need to be able to acknowledge their growth and the progress that they're making at reducing their use. To expect like immediate abstinence, maybe what's the word? It may not be constructive to set the bar too high, because when you set the bar too high and you say, okay, I expect complete and utter abstinence from you, and I'm going to drug test you, and this is the way we're going to do it, and I'm going to lay it on the line, and if you don't do this, then, you know, you're going to have all these things ripped away from you. You know, I mean, there is a time and a place for residential treatment. There's a time and a place for outsourcing the treatment to professionals. If you feel like you're over your head and you need that support, absolutely seek assistance for a higher level of care. But recognize that every step toward progress, every step toward a lower and lower dependence on whatever it is that they're using is critically important for them to incorporate and scaffold that success. You know, say, okay, well, I did it today, maybe I can do it tomorrow, you know, to be able to have that sort of self-awareness that it is a process. It's not like an on or off button. And the more nuanced the understanding parents have, the more available they are to support their kids in a meaningful way.
Yeah. Well, it's hard for all involved, you know, being a human and having, you know, just the human condition and being vulnerable is a hard thing for everybody. And so I think, you know, all of the information and tools that you shared are super helpful. So
yeah. And I keep thinking of a few things that are left over in my mind. I don't want to, I cannot emphasize enough the power of teens on other teens, right? We presume that it's mostly negative, but you know, it's really not all negative, though. There's a lot of power in teen positive influence, and knowing that, you know, your teenager has reliable friendships and that they're cultivating, you know, friendships that they can trust, that they can be authentic in what they're sharing with their teenagers, if they're involved in teen groups, if they're involved in team sports, if they have a core group of people. I mean, I think that's one of the biggest risk factors for drug use is isolation, is having that disconnection to peer groups, you know. Right. So being a good friend is also really important, to having a good friend and being a good friend. And all we have to do is kind of look at the power of our either spousal relationships or friend relationships in the community. And you know that that's what's enriching to us as adults. So of course, that's what's enriching to your emerging adult as well.
Right. And I think too, you know, you mentioned before having the refusal skills to be able to say, even in a good group of friends, if the friends decide that they're going to try or explore or experiment, to be able to give yourself permission to say no, and sometimes multiple times, you know, within that group of friends, to be able to, you know, refuse and still feel good about yourself, and, you know, potentially move on to a new group of friends if that group of friends is headed in a direction that you don't feel good about, or that you just don't want to participate in. I know, you know, just in my own history, that was tough, you know, in high school, having, you know, friends who wanted to try alcohol or drugs, and, you know, being able to refuse that and then feel like I have no one left. What am I going to do now?
Right.
So I think even, you know, parents sharing those experiences and saying, you know, here's what I did, it did or didn't work. I think it's a good thing to know that, you know, as a teenager, your parents went through some of what you went through, and it may be different now, you know?
Yeah. And I think that with one caveat, right? It's like, there's differences in opinion on this topic, like from a therapeutic perspective. Like, should you tell your kids what you did when you were a teenager? Yeah. And the answer is really, it highly depends, right? It's not like telling them, you know, about the escapades that you experienced is going to necessarily connect you or empower you to say, okay, well, I did this and it was really a bad situation and I wish I didn't. And had I not done this, I would have done this. Just by saying that you did it is in some way condoning that it's normal teenage behavior, right? So I think it's really important to be mindful of what you share with your kids about your previous history with drugs and alcohol, or being curious about why they're asking. Like tell me what, why is it important to know that, like help me understand what you're struggling with, but to really take every opportunity to really get behind the reason for what their questions are about your own history. And also not to come off as dated, right? Like, oh yeah, well that was then and this is now and things are different now, right? And I would say that there is a subset of kids that are in a lot of trouble. They're in over their heads because they're experimenting with larger and larger amounts of cannabis. And there's, milligram labels, right? Like back when we were younger, we didn't talk in those ways, right? Like there was no such thing. I think that if you know of a kid or if your kid is discovered to be experimenting with larger and larger quantities or larger and larger milligrams of THC, that there is a much higher risk of dissociation, of psychosis, of like losing touch with reality, in hyperemesis. There are all sorts of, physiological problems that go along with overdosing on cannabis that I don't think that peers are expressing to peers, right? It's all about being like, oh, I can handle that because I'm a super pro at this, right? And that's when we see tragic things happen with kids.
Sure. Yeah.
So what there is a time and there is a place to say, okay, I've discovered something that's far beyond recreational use. And again, I'm not condoning the recreational use. I'm just saying that at some point, if you realize that your kid is one of those kids that wants to kind of push the limits and explore the realms of, reality in that way, what are they really seeking? What are they really needing? What are they really trying to explore? Are they that bored, or are they that interested in the mind in a way that they're not able to access in another way? What are they reading? Who are their friends? What are their friends' parents, doing or saying about it? I think knowing your community, knowing your kids' friends, knowing your kids' friends' parents, is also another thing that parents can do to sort of open their minds to with curiosity about what their kids are exposed to out there.
Sure. And there's so much to unpack even in just what you just said, Jodie.
Right.
I think so often parents don't have an opportunity to really know other parents. I know lots of parents who've said, now that my child is in middle school or high school, they don't want parents around. And, it is both awkward and uncomfortable, to try to learn a little bit more about the families that, my child's been invited to, come to their house for the weekend, but I don't know who they are.
Mm-hmm.
But how do I get to know them, before I say yes or no to allowing my kiddo? And then once my child is driving and they have access to the car, how do I set some limits there? So definitely lots more we could unpack there.
Right.
We'll have to save that for our next podcast together.
Sounds good. Let's do it.
All right. Well, thank you so much again, Jodie, for your time today. I really appreciate it. And I'll provide the contact details for getting in touch with you if that's okay.
Sure. Yeah.
Who may have additional questions or, want to seek some resources. I'll provide links to some information that Jodie and I feel are good for, parents and for mental health professionals and for people in general. So
great. Thank you, Cara.
Yeah, thanks so much. I really appreciate it. And thanks to everybody who joined us today.